All right. Good, depending on where you are, good afternoon or good morning to you. And thank you very much for joining us today. My name is Joe Shapiro, and I am the Director of Media Relations for ACOM. And ACOM is very excited to be able to present this webinar as part of our Pride Month celebrations. Just a few housekeeping issues. There will be plenty of time for questions, so please use the chat to type in your questions as you think of them. Dr. Holt has graciously agreed to stay on for extra time if we need to, so your questions will be answered. Without further ado, let me briefly introduce our presenter. Ronald Holt, DO, is a board-certified psychiatrist, author, and national speaker on LGBTQ healthcare and civil rights. He presents at regional, national, and international psychiatric conferences on topics relevant to improving the mental health of our queer youth. Dr. Holt has also presented at many DO schools and at OMED on how to provide a safe and welcoming clinical environment for the LGBTQ plus community patients. He has received several awards across the country for his community service and his commitment to diversity. In addition to being a Kansas City University adjunct assistant professor, Dr. Holt currently practices as a student health psychiatrist at San Francisco State University. And it is my honor and pleasure to introduce Dr. Holt and turn it over to him.
Okay, great. Thank you so much for your everybody coming today. I really appreciate it. It's an honor to be with you. So I'm gonna go ahead and go over some slides with you, and then at the end we're gonna have I'm gonna stop sharing, and then we're gonna have plenty of time for Q&A. So again, if you do have any questions, just feel free to drop them in the chat, and we'll get to them at the end. If we need to stay extra time, I will stay as long as we need to make sure that all of your questions are answered. All right. So again, thank you very much for sharing your time with me. So I'm going to go ahead and share a screen with you. It says how to create a safe and welcoming environment. All right, here we go. Okay, so I'm just going to give you a little bit of an overview. I'm going to be doing some storytelling for you because I think it's really important for us to understand what our patients are coming in with. Then going to talk about how to create a safe and welcoming environment in the clinic, and then again, we're going to have our question and answer at the end of our session. And so here's some learning objectives for us. I realize that there's physicians in here, there's students, there's other healthcare providers, and there's people who are not in the medical field, but I just want to give you an outlay of what we're all going to learn. And the first one is to discuss how LGBTQ patients are at higher risk for health disparities. We're also going to explain the way to create a safe and welcoming environment for LGBTQ patients, allowing for more optimal care. We're also going to demonstrate how to approach sensitive topics with their LGBTQ patients to enhance patient disclosure and good subsequent outcomes. And the last is describe how to set the stage to make someone feel comfortable coming out to you as LGBTQ, whether you are their physician or you're their nurse or you're a colleague of theirs or even a friend. I'm going to give you some role-playing examples of how to make someone feel comfortable coming out to you. Okay, so why is this lecture important? Well, it's really important because the importance of us living our truth, not just us, but our patients and everybody around us. And there's a little quote here that I want to show you that I got from Twitter last year, which I thought was very succinct and kind of helps and explain why we're here today. I've been a hospital chaplain now for 8 years at hundreds of deathbeds. I want to tell you something that I've witnessed. Most people at the end realize that they've spent a lot of their time in life hiding, sometimes by choice or because they could not safely choose to be themselves. At a deathbed, if my patient can communicate, they show that they're dying two deaths, the one that they're dying, and then the death of the life that they really wanted to live. But in their dying, some are also free to tell me who they are, what they wanted, who they had to hide. They're finally free. And I thought this would be a good way to start because our patients come in and we want them to be authentic and we want them to be free to be open and honest about who they are. And when they are able to do that, then we're able to provide them the best care possible. So I'm going to start with why is this important? So I'm going to give you some scenarios, some real life scenarios. I'm just going to tell you brief about my story coming up, growing up as gay. And then I'm going to go over some surveys for you from the US trans surveys, as well as the Trevor Project. And then I'm going to go over some real life examples for you of people who have written into me and told me their story. Because I think it's really important for us to know what is it that patients are coming into in real time, and what it is that they're struggling with, and which will also show us why it's so important for us to create a safe and welcoming environment. So when I was young, I was born and raised in Nebraska, and I really struggled with my sexual orientation. I didn't know how to put a label on it, but I knew that I was different from the other boys. But I didn't really have any support then as well. And I certainly didn't have any support from a medical standpoint, such as having an open and safe environment in a clinic where I'd be open and honest about who I was. And so I really struggled with that a lot, and all the way through high school and college and even into medical school. And when I came out to in medical school to my father, it was not a pleasant experience. And so I really reached out for resources, including the doctor that I was seeing at the time. And I didn't have any resources that were made available to me. And so I think it's really important to realize that even today that people are struggling with their sexual orientation or their gender identity, and they're going to reach out to us as their healthcare provider to make sure that we can give them the resources that they need. And we also need to create a safe and welcoming environment so that they feel comfortable actually coming out to us. Okay. And so I know that there may be some of you that are listening to this program that may be struggling yourself. Please know that you're not alone and that you're loved. If there's any resources that I can offer you that you can't get through your regular doctor, please feel free to reach out to me. I'd be happy to help you. Okay. So the next thing we're going to do is we're going to go over some surveys. And the first one was the 2022 US Trans Survey. And so I want to give you an idea of what trans patients are actually experiencing when they come into our office. First thing is that roughly a third of them describe themselves as being homeless at one point in their life. Almost over one third were living in poverty versus 11% in the general population. 44% had some kind of psychiatric distress in the previous month compared to just 20% in the general population. And over one third reported their health as being fair or poor, and that compares with just 13% in the general population. 26, so this is what they experienced coming in for healthcare. One quarter reported that they had at least one issue with insurance denying either gender affirming care or basic trans healthcare. Almost half had at least one negative experience in a healthcare setting. That could be where they were refused care, they were misgendered, maybe had physical or verbal abuse when treated by their healthcare provider. A quarter did not seek healthcare due to fear of mistreatment, and over a quarter did not go to a healthcare provider due to cost. The next survey that I want to tell you about is called the 2023 Trevor Project Survey on LGBTQ youth. And this was over 28,000 LGBTQ youth from the ages of 13 to 24, which makes it the largest queer survey done in the United States. And you can see these staggering mental health issues. 41% seriously considered attempting suicide in the previous 12 months. 14% actually attempted suicide in the past year. Over two-thirds reported symptoms of anxiety, and over one half had symptoms of depression. And 56% reported wanting mental health treatment, but were unable to receive it. Okay. Another 15% reported being threatened with or subjected to conversion therapy. One third said that their mental health was poor most of the time or always due to anti-LGBTQ policies and legislation. And nearly 2 in 3 said that hearing about potential state or local laws banning discussion on queer people at school made their mental health a lot worse. So I also the last part I want to give you is some real life examples, and these were sent to me in December of 2018 and 2019. When I usually have a lot of people that will reach out to me when they're struggling during the holidays, not being able to be around their family, and so I started a coloring book campaign where I gave away some of our Pride coloring books, which we'll talk about a little bit later. And on the form that they filled out in order to get the coloring book was I just left an optional question on there that says, please tell me about yourself. Okay. And so these are 5 people that I want to share with you from different parts of the US that told me what they were experiencing at the time. And the first one comes from rural Kentucky. I was kicked out after years of fighting my parents about my identity shortly after I graduated high school. The holidays since have always been lonely, and they tend to get me down at times because I've always been a huge holidays fanatic. It's always strange now when it's just me sitting home by myself and not celebrating, but I would never give up my identity. I am proud to be the transgender male that I am, and I hope to be getting top surgery in this new year. The second one came from rural California. I'm a school counselor at a school with many students that identify as LGBTQ+. Some are out, others are not. But with the fears they all face, I often have a student that needs to talk, color, or cry, or just be. With me, they are safe and accepted. And what better way to continue to show them this than with a book that speaks to the love that I wish for them? The next one was from rural Utah. I'm a college student who recently came out to my conservative Mormon family. I had to drop out of BYU and take a full-time job to provide for myself. I read your book and loved knowing that my experiences are not unique and that I'm not alone. This one was from rural Oklahoma. I first realized my sexuality 4 years ago when I moved to Oklahoma with my dad and met my best friend. Recently, we have started dating. I decided to come clean to my family, and that resulted in me being kicked out about 2 weeks ago. I'm now staying with my girlfriend and her family. Unfortunately, I lost my job due to ties with my family. The holiday season is rapidly approaching, but I still have my girlfriend's family, and I am so grateful. And this last one was from rural California, who said, I'm a trans, I'm trans, and my family doesn't know. Every time I visit them, I have to hide my binder, get dead named, and misgendered. I'm too scared to come out to them. And this last one was from rural Minnesota. I am bisexual and I am too afraid to come out because I don't think I will be taken seriously or accepted. So you can see that even now in the past 5 years, people are still struggling with their sexual orientation and their gender identity, and they're hiding it. And they're hiding it from us as practitioners when we don't allow a safe and a welcoming environment. So now you know the importance of what we're going to talk about next, right? You heard my story, you saw the surveys of what they're going through, and you saw some real life examples. So what we're going to do now is talk about how to create a safe and welcoming environment. And here's a list of things that we're going to touch on. We're going to talk about the waiting room, the intake forms, the interactions with us as providers, the risk factors for LGBTQ folks. We're going to talk about how to start a sexual history. We'll talk about trans interactions, the coming out process, and how to help someone come out to you. And then we're going to talk about suicide assessment. Okay, so the first part is the waiting room, right? That's setting the stage for the person to come out to us. And so first impressions to a healthcare setting can really make a big difference and how comfortable patients feel with us. I can tell you as a gay man that when I go into doctor's office, the first thing I'm doing is scanning the waiting room to see, is this a safe environment? And examples that you see on here is there a unisex restroom as opposed to it being labeled male or female? Is there a non-discrimination clause somewhere? Maybe that's posted somewhere in the waiting room, or perhaps on the forms when they fill it out. In addition to good housekeeping or Cosmopolitan magazine, are there LGBT specific magazines that are in the waiting room that are sending the message that you are a safe environment? And the other one of the other things is, if you've got brochures up there on various things, do you have one up there on LGBTQ health? So these are ways for us to be welcoming before they even come in to check in with the receptionist. So the next one then, so they walk in, and then we look at the intake form, right? So for a lot of intake forms, it could just have gender as being male or female. A more inclusive intake form, which would make them feel more comfortable coming out to us, is perhaps maybe you can see on the left side here where it says gender, female, male, transgender, or other. Under sexual orientation there on the right side, bisexual, gay, heterosexual, lesbian, queer, not sure, don't know. So what we're doing here is by having these options on here is we're making these people feel like, wow, this feels like a safe environment. They're actually allowing me to mark down who I truly am and what my sexual orientation is and what my gender identity is. And so something else here to think about is that when people don't fill out these forms, that's also telling for you as well, right? So for instance, like when you're walking back and you notice that someone doesn't fill out the intake form under sexual orientation, that's totally information for us to use to our advantage. You could say, you know, I noticed that you didn't mark anything under sexual orientation. Yeah, doc, I didn't really feel comfortable talking about that, right? Or you say, I realized that I see that you didn't put anything down under gender. Well, yeah, that's something that's really kind of uncomfortable for me, but that's something I'm willing to discuss later. So this kind of lets us know where we need to go in our dialogue when patients are coming back in the office with us. Okay, the second thing, or the third thing then, is the interactions with us as providers. And so the first thing, honestly, when we're walking back, we might have the intake form with us. We have maybe 15 to 20 seconds to review it before we get them back into the room. And so by us taking a look at that, we kind of have an idea of what areas we need to discuss with them before the actual session begins. And so it's really important for us to use their terminology. So if someone marks down on their form that they identify as queer, then that's the term that we use. If someone marks down that they're gay, we don't say, oh, I see that you marked down that you're queer, because queer may mean something different to them than being gay does. And so we never want to offend somebody. We want to use their terminology. And if there's terminology that a person uses with you that you don't understand, it's okay to ask them that. So say that someone marks down under gender identity, hey, identify as gender queer. You could say, you know, I see that you marked down gender queer. I'm wondering what that term means to you. Okay, so it's important for us not to guess, but if we don't know, it's okay to ask. The next thing would be the use of pronouns, right? So we could introduce ourselves to make the patient feel comfortable introducing their pronouns in the following way. So, hi, my name is Dr. Holt, and I go by he and him, and you are, right? So by us doing that, we're giving them permission. Like we started with the use of our pronouns, we're allowing them permission to use their pronouns as well. Another nonverbal way for us to make them feel that we're safe and welcoming is maybe to have like a rainbow pin on our white jacket, or maybe a little trans flag on our white coat jacket. It doesn't have to be large. It could be, you know, a quarter inch by a quarter inch or something very small. But what kind of message are we sending to those patients who may be closeted or hiding? Right? That we're a safe person, right? That we have this flag on us that says that we are safe to be able to talk to. Do you have to be LGBTQ to have a rainbow flag or a trans flag on your jacket? Absolutely not, right? But what we're doing is we're demonstrating to them that we are creating a safe environment, and that hopefully they'll feel more comfortable coming out to us when they are ready. And the last one here is to disclose if appropriate. I'm going to give you an example of that. So say that you are in a large urban center and you actually advertise in LGBTQ affirmative magazines that you're a doctor who's available to help people with queer health. If you feel like maybe they're kind of hemming and hawing and they're not sure whether they feel comfortable or not, you know, a way to say it is like, hi, Mr. Jones. My name is Dr. Holt. I go by he and him. It's a pleasure to meet you. How was your weekend? And they may say something, and then I would say that's great. My husband and I went out boating this weekend or whatever. And so if you feel like it's an appropriate place for you to disclose to make the patient feel more comfortable with you, then by all means do it. If you don't feel like that's appropriate, that's okay too. Remember, we're just trying to give them different venues or ways in which they feel safe and comfortable with us. Okay. So the next thing is that we could talk about risk factors that are impacting LGBTQ patients. And so sometimes it's important for us to ask about their experiences and open-ended questions. So for example, and say this person already marked on their form that they identify as LGBTQ. You could say, John, in the LGBTQ community, people struggle with depression or anxiety or some other mental health issues because of the way that society has treated them, either through discrimination or stigma. I'm kind of curious, has that ever happened to you? Well, Doc, as kind of a matter of fact, it did. I mean, I've really been bullied throughout my life. Oh, really? Thank you so much for telling me, John. Please tell me more. Right? So that opens the door for us to open-ended questions to find out what it is that they're struggling with. It's also okay for us to acknowledge those risk factors. John, in the LGBTQ community, we're at higher risk for drug and alcohol misuse due to society's prejudice and stigma and/or discrimination towards us. Has that ever happened to you? I'm so glad that you brought that up, Doc, because a matter of fact, I feel like I have been drinking more. And it seems like ever since I went to this job where I feel like I'm being harassed because of my sexuality. Right. So we're opening the door and we're acknowledging risk factors and normalizing the conversations so that they feel comfortable coming out to us about what's going on with them when they feel ready to do so. So we're setting the welcoming stage for deeper discussion. So is the patient actually going to talk to you about this in the first intake? Maybe, maybe not, right? What we're doing is we're setting up a safe space for them. So longitudinally, when we're seeing them over the months and years, they feel more and more comfortable with us. And they may say, I remember during the intake, you told me about things to look out for. And I feel like I'm ready now to talk about that. Right? So we're setting the stage for deeper discussions. We never want to force anybody to tell us things. We just want to make them feel safe and welcoming to tell us when they're ready to. Okay. So opening the door to a sexual history. So for instance, like you see on this little form here, are you HIV positive? Yes or no? I've been diagnosed with and or treated with, and there's various STIs on there. You can also see on there on the right side, check any of the following that apply to you, and it talks about different things that they might be exposed to. So they may or may not talk about their sexual health history when we first see them, but I can promise you that by them seeing these options that are on the intake forms, they're going to be much more willing and feel safe to come out to you and talk about their sexual health when they're ready. And again, on the sexual health part, them not answering it is just as good as them filling out the form. And so, for instance, like you can say, notice, John, thank you for filling out these forms, but I noticed you didn't mark anything on sexual health history. Yeah, Doc, I don't know. That's kind of a sensitive subject for me right now. I don't really feel comfortable talking about that right now. It's like, oh, okay, John. Well, I appreciate that, and I'll mark that down in my notes. Do you think that may be something that we could visit the next time that we see each other? Because I think it's important for us to talk about sexual health, but I also want to understand you may not be ready to do that at this time. Yeah, Doc, that sounds like a great idea. Okay. So again, we're opening the door for them to feel comfortable telling us things when they feel ready to do so. Okay. And so the next thing would be opening the door to trans health. All right. And so that really starts with our intake form, right? So if someone marks under gender, instead of just male or female, maybe they'll mark not sure, or maybe identify as trans, or maybe identify as gender queer. And so that's kind of the opening for us as we're having discussions with them. And so the other thing I want people to realize is that we as physician and other healthcare providers, we're not perfect, right? And there's times that we may accidentally offend somebody. And so what's the first thing that we do when we accidentally offend? We just apologize and we move on. right? We don't make a big deal of it. We just apologize and we move on to the next stage, right? So I'll just give you an example. I was given a talk in 2010 back in Nebraska, and I misgendered somebody in the audience, and they became very offended, and they stood up and they said, I'm very offended that you misgendered me. And so I very quickly said, I'm very sorry. I did not mean to misgender you. I will definitely learn from this. I'd like to talk to you after this session that we have together to talk about how I can be more inclusive. And then we went on. Okay. So there's nothing wrong with us saying sorry. It really takes away the anger that someone may have towards you, because we're not doing it to be mean, right? We're just doing it because maybe we don't have the knowledge or training that we wished we had. Okay. The third thing here is honesty about knowledge. So, for example, maybe someone comes in and they filled out on the form that they're trans, and maybe on some other forms they said that they're interested in hormone therapy. We, as physicians and healthcare providers, have not been trained. A lot of us have not been trained in how to provide trans care, and it's okay to say that. You may be, say, you're in a rural area, say you're in rural Missouri, right? And someone comes in and they want to get some trans health care. It's okay to say, I affirm your gender identity, and I wish that I had more information on trans care, but I don't. But I do want you to know that when we're done talking today, I'm going to have the nurse reach out to you at the end of the day, or the MA, and have them give you some resources for doctors who are totally compliant, that are totally knowledgeable on trans care. Okay. And I think patients are much more likely to feel very comfortable with you if you're just honest with them. If you don't know, that's okay. Just tell them that, right? And the last thing, which I think is a real clinical pearl here, is we need to assess what is present. All right. So you may say that you have maybe a trans male that comes in, someone who's transitioning from female to male, and maybe they haven't had a pap smear done for years, or maybe they haven't had any, like a breast evaluation done because they felt very uncomfortable with doing that, or maybe they don't identify with the anatomy that they were born with. Okay. So a way to talk about that is that, I really affirm your gender identity. I want you to know that I am here for you, but I would be remiss if I didn't mention that we need to treat the organs that are present. And so I've noticed that you haven't had, any testing done. You haven't had a pap smear for a while. You haven't had a mammogram done. I really recommend doing that, right? And they may come back and say, you know what, I'm sorry, but I don't identify with the anatomy that I have right now. I don't feel comfortable doing that. And so are we going to force them to do those tests? No. But what we are going to say is like, okay, thank you so much for telling me. I understand that. I'm going to make a note in your chart. And so when I see you again, maybe we can revisit that. Does that sound okay with you? Yeah, doc, that sounds fine. Thank you so much. Okay. If we force people to do tests, or we force them to do things that we think is best for them, but they're not ready, you know what they're going to do? They're not going to come back. And so we need to provide them a safe and welcoming environment for when they are ready to get the test that they need. All right. The next one here that I want to talk about is opening the door to someone coming out. All right. So, say for instance, like maybe you have an LGBTQ affirmative clinic, and you've got all the right things that are out there. Your waiting room is great. Your intake forms are great. You've got your little rainbow pin, right? You use pronouns. Everything's wonderful. However, the patient may not be ready to come out to you, right? So we kind of have to assess wherever the patient is. And we need to form an alliance with them. People only come out whenever they're ready to come out, and whenever we make them feel comfortable. And so I'm going to give you 3 examples of ways to make people feel comfortable to come out to you. All right. And you can use this either professionally, or with your own child, or with a colleague. Okay. So the first one I'm going to do is with a patient. So, hey, John, it's been great working with you. I really enjoyed being your primary care provider for the past 5 years. I feel like we've developed a great professional relationship. John, I want you to know, if there's ever anything in your life that you haven't shared with me, our professional relationship will never change. And then you drop it. right? If they're ready to come out to you, or maybe there's something they haven't shared with you besides their sexual orientation, that may be the time that they do it because you've opened the door. But if they're not ready, trust me, you will be one of the first persons that they come out to when they're ready to do so because of what you just said. Another example could be like a colleague of yours. Say maybe you've known a colleague for 5 or 10 years and you feel like maybe they're struggling, or you want them to know that you're safe. So here's another example. Hey, John, it's been great working with you in the ICU. I can't believe it's already been 7 years since we've been out of residency and we've been here at the same hospital. I feel like we've really become like siblings together. If there's ever anything, John, in your life that you'd like to share with me that you haven't, please know that our relationship will never change. And then you drop it, right? If they're ready to come out to you, they will. But if they're not, that's okay. At least you set the stage. All right. And the last one would be for a son or a child. And this, I think, kind of pertains to all of us because believe it or not, there's a pretty good percentage of you that will have a child that comes out to you as LGBTQ, and how we respond to them can make a big difference. Also, we need to make them feel safe and welcoming. So if you feel like maybe your child is struggling, or you just want them to know that you're a very cool parent and who's open and honest, and want them to feel safe, here's an example for that. Hey, Johnny, happy 13th birthday. I love you very much. My love for you is unconditional. Hey, Johnny, if there's anything in your life that you'd ever want to share with me, please know that my love for you will always be unconditional, and I'll always be there for you, right? And the child may say, gosh, Dad, I don't know why you'd say something like that. That's kind of weird. That's okay, Johnny. I'm just letting you know that I'm here for you. If Johnny feels comfortable, it's like, Dad, there's actually something I've been wanting to tell you. And I told myself that I was going to tell you during my 13th birthday. Or if they're not ready to come out, they may not say anything. But again, I can promise you, when your child is ready to come out to you, you are going to be one of the first persons that they came out to because of that conversation, that opening that you just gave with them. Okay. We never want to prematurely out someone. We can make the comments that I just said, but you do not follow it up with saying, I think you're gay. I want you to come out. We do not do that, because then we put people at higher risk. So what might be the consequences of premature outing? Well, people have panic, they can anxiety, they can have depression. It can lead to substance misuse, either drugs or alcohol. For some people, if they have panic and they've been prematurely outed, say on social media, they can have intense thoughts of suicide. And so there are definitely consequences to prematurely outing somebody, and we never want to do that, whether we're their parent, whether we're their doctor, or whether we're their colleague. Okay. So opening the door to suicide prevention. Okay. So the two most common things that we need to assess when we're with someone is if they've had previous suicidal ideations, or suicide attempts, or actual thoughts of suicide in the moment. All right. So we need to assess the patient wherever they are. And I know for some people, this can be a sensitive topic, but if say that someone fills out a depression scale for you at the beginning, and they mark down their thoughts of suicide, by all means, we need to assess them, right? And the way that we do that is we need to normalize the conversation. So it's like, hey, John, I noticed that you marked on here that you have thoughts of suicide more days than not. I appreciate you telling me that. John, in the LGBTQ community, we're at higher risk for thoughts of suicide due to discrimination or due to stigma. And so I just want you to know that's not uncommon. Do you have thoughts like that right now, or do you have active thoughts like that? Oh, you do. Oh, Craig, yeah, thank you for telling me. I really appreciate that. Please tell me more. Right. So we're opening the door, and people only feel as comfortable talking about mental health and thoughts of suicide as you, the provider, are as comfortable discussing it with them or bringing it up. Okay, so I just want to tell you here the risk from highest to lowest in the LGBTQ community. So trans people are at highest risk. Most studies show that around 41% of trans people have had a suicide attempt at some time during their life. So that should be high on your differential when they first come in. trans people of color, over 50% have had a suicide attempt. These aren't thoughts of suicide. These are people who've actually had a suicide attempt. All right. The next would be people who identify as bisexual or questioning. They're about 4 to 5 times more likely to attempt suicide compared to their heterosexual peers. Then gay men, roughly around 2 to 3 times more likely compared to their heterosexual peers. And then lesbians are about 2 to 3 times more likely. So in the LGBTQ community, trans people are at highest risk and lesbians are at lowest risk. They're all at risk. And so you need to assess that, especially if they fill out some forms that talk about that. But high on your differential should be, we need to rule out this and when a trans person comes in for treatment, just based on what they've experienced throughout life. Okay. All right. So here's some protective factors against suicide. And this came from the 2023 Trevor Project survey. So trans and non-binary youth whose pronouns were trans and non-binary youth whose pronouns were respected by all of the people that they lived with attempted suicide less than those who lived with others who did not respect their pronouns. Okay. Second thing, trans and non-binary youth who reported having access to a gender neutral bathroom at school reported lower rates of attempting suicide. And the last is LGBTQ youth who had access to affirming spaces, such as a doctor's office, right? Or maybe a affirming space at school, reported lower rates of attempting suicide. Wow. Okay. So to recap that, we as clinicians and as providers and just people in the community can help reduce the risk for suicide in the LGBTQ community by just doing 3 things: using their correct pronoun, having access to a gender neutral bathroom, right? And helping create a safe environment. All right. I know that we all have the ability to do that in our own ways. Okay. So we're almost finished here on the slide part. And I just want to tell you I did a program called Delivering Pride to LGBTQ Youth, where it was a coloring book giveaway through GoFundMe in 2018. And I got back some pictures from the teachers who gave me permission to use these up on social media to show just how happy people were with getting something that was affirmative to them, that created a safe environment through coloring. And so the pictures on here, these are people that were at a prom down in Dallas area. And the other ones were pictures of people from a rural village in Michigan. And I just want you to be aware that if you go to pridecoloringbooks.com, I've got the ability for you to do free downloads of these Pride coloring books. And so that is available for you, pridecoloringbooks.com. Okay. All right, so that's the end of my slide presentation here. I purposely ended up a little bit early because I wanted to have plenty of time for question and answer. I am now going to stop sharing my slides, and I now would like to go to Q&A. All right, so the Q&A can be anything that we just talked about, or it can be things that maybe we haven't talked about that you have interest in knowing more about. Thank you very much for your time.
If people would like to submit their questions in the chat, we can read them off, or I think we could also do the hand raise if you feel more comfortable asking your questions verbally. So either way, please let loose. We're here. Dr. Holt is here for you.
I know the first questions are always the hardest, but there's no judgment. We are a safe zone here. And so any question that you have is certainly valid. And I'd be happy to go into whatever topic or area that you'd like to. So that okay, so that's a great question. So here, someone wrote in, where can we access posters or signs to show safe spaces? That's a great question. So there's a couple of websites that immediately come up for me. One is called the Gay and Lesbian Medical Association, and so if you go to GLMA. .org. That's glma.org. They should have some resources that are available for you there. There's also the American see, I'm trying to think out loud here. UCSF has a trans clinic as well, and they probably have some resources there as well for you. The other thing too is that you might want to reach out to the Human Rights Campaign, hrc.org, because I know that they have also got some issues around helping people with mental health and physical health care as well. So that may be another place that you would want to go to and see what resources that they have available for you. Okay, very good. So, see, as a clinician, when you introduce yourself with pronouns, have you come across belligerent patients? Not, no. Okay, so that's a great question. And so I've had other people that have asked me that as well. So say that you go out and say, "Hey, my name is Dr. Holt, and I go by he and him, and you are." And they may say, well, does it, what do I look like, doc? I'm a guy, right? And so, it's okay to say, I'm sorry, I'm just trying to be inclusive for everybody here. Not everybody necessarily identifies with the pronoun that they were born with. Okay, so just something very easily said. We don't have to go into it with them. If they're upset with it, it's okay to just say, "Hey, listen, I'm just trying to be inclusive. That's all. It's nice to meet you, right?" And just bring them back. Okay. So let's see here. Um, so the questions are going through. Maybe if I could get some assistance with
Yeah,
them.
here, I'm happy to
Okay.
read some of the questions to you.
Okay.
All right. This is from somebody who teaches first year medical students. What is the
Awesome.
best platform for teaching students? Live lecture, online modules for self-study, or panelists?
So that's a great question. So I would say all of the above. Certainly, panelists have been very helpful. I've gone into a lot of DO schools and I've been a panelist or a moderator or just a presenter to talk. I think it's the old saying about we need to expose people that are role models in the community, and so I'd be happy to come out and talk. Also, there are modules that are available online. They're also, I think, doing panelists with maybe LGBTQ patients in the community and having them come in and sit down so medical students can hear the experience of people in their community, what they go through. I found that to be very helpful. And then also just kind of creating some lectures on your own would be very helpful as well. Very great question.
Okay, great. Here's one, Dr. Holt. I'm about to start my third year rotations. I'm curious if you have any advice for medical students who want to practice creating space with our patients to be themselves, but the preceptor we are working under is not open to reducing discrimination.
Great question. I love it. Thank you so much for saying that. So here's some, and I've heard that from other residents and medical students over the years that I've been doing that. So here's a couple of things that you can do. Perhaps maybe you've got a preceptor who's not experienced in queer health, or maybe it's an older preceptor that may not had any training at all. And so there's ways that we can create a safe and welcoming environment. So for instance, like say, generally speaking, a medical student or resident would go into the room right before the doctor does. And you might be able to say, "Hey, my name is student Dr. Kim," right? And I go by she and her, and you are, right? And so, or you might have like a little flag pin that's on your coat. So there are ways, both verbal and nonverbal, for us to send messages to the patients that we are safe and welcoming. Are there going to be times where you may have a preceptor that's not safe and welcoming? Yes, that's true. And you don't necessarily have to have conversations with them about how you feel about it, but certainly you can let the patient know that you are safe. And trust me, if they, especially if you're on a rotation long enough, you may say that you're in the hospital system, you may see them every day, and you may develop a very close relationship with them, a professional relationship, because you create a safe and welcoming environment for them to tell you things that they may not tell the preceptor, who may not be as open and honest as you are. Great question.
Okay. Dr. Holt, this is sort of builds on that question and sort of takes it to the next level.
Yes.
What would you recommend to do when your preceptor, supervisor, authority figure actually makes ignorant or negative comments about a patient or just the LGBTQ community in general?
So that's a great question as well. And I know a lot of times that we don't feel comfortable, us, because we are either the resident or we're the medical student, so we don't feel comfortable telling them how we feel. But sometimes going to the program director or maybe going back to your school. So say that you're a third year somewhere and you're at KCU and maybe you've gone to a hospital somewhere in Missouri and you feel like your preceptors being very transphobic or homophobic. If you don't feel like you have the ability to say something to them, certainly either talking to the program director that you're in or talking to maybe your school student affairs office and say, hey, listen, I'm really struggling here at this rotation because my patients aren't getting the care that they need because the doctor's being homophobic. What can I do to make this better? Because remember, in my opinion, being a preceptor is kind of a privilege to be able to help others. And if they're not creating a safe and welcoming, teachable environment for you, then I think the person that's hiring them, i.e., the school, has the ability to come back and say, "Hey, listen, we've gotten some feedback from the resident or from the medical students that you're not making them feel comfortable and that you're discriminating against a certain segment within society. What can we do to make that not happen?" Great question.
Great. Here's a question about what topics would you recommend for a pediatric residency program director for teaching residents?
So I think that's a great question. And so what I would recommend doing is a talk similar to what I just gave you, where you talk about how to create a safe and welcoming environment for peds or children. And so let's just talk about that a little bit. Kids who are their sexual orientation, they know usually around puberty or can start to recognize that. So that can be anywhere from 9 to 13, right? For trans people, I've been in some conferences where I've seen panelists where trans people come out from anywhere from age 2 to 3 at the earliest, right? So we know that kids are struggling with their sexual orientation or gender identity, certainly during their pediatric years. And so I think it'd be very important for them to have a talk on this, maybe for a pediatric grand rounds, to have someone come in and talk. Or I think what would be even better is, with the parent's permission, is maybe have an out trans kid or maybe an out queer identified person be on a panel to talk to the pediatricians there about what they go through and the struggles that they have because they don't have a safe and welcoming environment either at school or there in the clinic.
Okay. Here's a question from somebody who works in graduate medical education and faculty development. What would you consider the best way to teach faculty on LGBTQ plus issues?
Great question. So the talks that I've given in the past, when I've gone to some of the DO schools, I'll actually, in addition to talking to the classrooms, I'll also have like grand rounds for the faculty and staff, where we'll all kind of get together and either we'll go over vignettes together or I'll do a slide similar to this about how to create a safe and welcoming environment for students, right? Or for patients. But I think the best way to teach someone is through exposure and education. A lot of times people in faculty don't know what they don't know. And I'm hoping that some people learn some things today that they didn't know before. And that's certainly true in a faculty setting as well. And so my experience has been bringing somebody in, or if you don't have the ability to do that, maybe having a panel again, maybe of students or maybe other faculty who have an interest in this so that they can teach them the things that they know so that they can help those who don't know have a better idea of what they need to know.
Great. Here's a question. Have you ever had to mediate a conversation between someone trying to convert an LGBTQ individual, and how did you address that?
So that's a great question. So I personally have not had like in a clinical setting where maybe a parent is trying to get somebody involved, but I can tell you there's so many people that have written into me, or maybe that have come up and talked to me after a talk or a presentation. And so I think what I would say to that kind of conversation is that, for instance, like say that you are a pediatrician, right? And you have a kid who's struggling with their sexual orientation, and maybe they've come out to you because they feel safe and welcome with you, but maybe they haven't come out to their parents yet, right? Because their parents are very homophobic. And so maybe a conversation could be, maybe if you're in the room with them, so I'm just creating the vignette as we speak, and maybe the parent starts gay bashing and the kid says, I don't really like that kind of behavior. It's like, and then maybe you as the clinician could say, hey, hey dad, I really appreciate what it is that you're saying, and I appreciate that maybe you've got feelings that are different than what your child is saying here today. And the important thing that we have to realize is that we're here for your child. I understand that you've got some issues going on for you, but we're here for your child, and your child just came out to us, and so we need to create an environment that's safe and welcoming for them, so that they are able to live their best life. And also, Dad, there are some resources that I can tell you about if you have any interest in talking with other parents where their child has come out to them. And so, like an example could be PFLAG. It's called Parents and Friends of Lesbians and Gays. That's pflag.org. That's a national organization that has satellite little areas across the country. And so where parents get together and help each other. Like my son just came out, I'm really struggling, and they may go to a PFLAG group in their local community to give them the safe environment that they need to talk about what they're going through, and to have parents who are in later stages of their kid coming out to give them advice about how to help their student or their child live their best life.
That's great. Here's a medical student who's asking, what's a good way for medical students to get more comfortable with introducing themselves with their pronouns?
So I think honestly, it's just going to take time. And so I think maybe doing it on rotation. So let me just give you an example. Perhaps maybe people say you're in a rural area and maybe it's a small town, and maybe you feel like you don't necessarily need to use your pronouns all the time. That's fine. However, if you're like in an urban area, say like a large urban area, say like a general hospital, right, where you've got a lot of queer identified patients that are there, totally, I think it's appropriate there for you to be able to use your pronouns with them. And it's just going to take time for you to feel comfortable. And are you going to have pushback from some people? Yeah, you are. But are you going to help save the life of someone who finally found like a doctor or a medical student that made them feel comfortable because they used their pronouns first? I mean, imagine that. So if you go out and say, hey, I'm Dr. Holt, I go by he and him, and you are, wow, my name is my given name is John, but I go by Jessica, and I use the pronouns they. Wow, right. Think about the example that you just gave them from a healthcare provider, that you are safe for them. And then they're going to be able to feel safe telling you a whole plethora of other stuff that maybe they haven't told a previous provider or a previous medical student because of you in introducing pronouns.
Here's a question from a resident in training who is trying to cultivate resources for hormone affirming therapy for patients. Do you know a good resource or guidelines to assist providers with this?
Yes. And first of all, let me say how happy I am that there's medical students and residents here. This is awesome. So there is UCSF has a gender affirming care clinic. And I now so it's if you go to wpath.org, the World Professional Association of Transgender Health, so it's wpath.org. On there, they've got a bunch of different scenarios. They've got resources there. They've got how to refer patients for trans care. And I also think that they have some areas where you might be able to watch some webinars online as well. So that would be a good place to go. They've also got the latest standard of care for trans health on their website too. So that would be an excellent place to go to.
Excellent. All right, this one's a little long, so bear with me.
Okay.
Hi, I'm a first-year medical student, and I heard that last year the lecture given on sexuality was offensive to some of the LGBTQ plus students.
Okay.
And within the lecture, students were misgendered and other issues. The president of MedPride went to the school and told them, but the same professor is set to teach the lecture this year. As the current president of MedPride, Do you think there's a way I could talk to that teacher or the higher ups again before this happens? And what could I say?
Great question. So, I probably, if I were like a medical student, I probably wouldn't go up to that faculty member directly, because if they're already homophobic or they don't understand what they don't know, you educating them necessarily may not help. I imagine that if you've noticed that there are other people within your group that have noticed it as well, and there's always safety in numbers, and by all means, I would go to the dean of that section, or maybe go to the department chair of that section, and maybe by email initially saying we have some concerns, we'd like to talk to you as a group, and then come in and kind of talk about this is what we've noticed with this particular professor, and this is how we felt offended by it, and we want to make sure this doesn't happen to future queer identified medical students. Right. So I think that would be the route to do. I'm hearing a common theme here in these questions that people are running into a lot of things with people that either are their mentor or their preceptor or are a faculty member. And I don't want you to feel like you necessarily have to go to that person and say, hey, listen, what you're saying, I don't agree with. Always go to the higher ups, because maybe they've gotten these conversations from others as well. Or maybe they haven't and they don't know. And so I think going up to their dean or their supervisor to let them know would be very helpful. And maybe that person who's teaching that section of your curriculum is not the right person. And maybe there's someone else that could be, right? And perhaps maybe that professor doesn't realize how offensive they are. So I think letting people know from the appropriate levels down, I think, is the best way to go about that. Thank you for that question.
Okay. This one is more of a comment, but you might want to comment on the comment.
Sure.
One of the things I have frustrations with is getting buy-in from the other faculty here to use inclusive language in lectures and exams. I am an EM physician by training, but am also teach at one of the comps. I've been striving toward the adoption of more inclusive language, but it's slow to be adopted. If we cannot teach those students in the way they should behave, it makes it difficult for them to know the best way to help their patients.
Agreed. I totally agree with that. And so sometimes, and I have noticed this at some of the comms that I've gone to, that some are much further ahead in inclusive behavior and vignettes and use the use of terminology than others are. So if you're at a newer school or maybe a school that hasn't gotten as far, certainly I think maybe helping them educate them about what resources are available in the community on how to create a safe and welcoming curricular environment would be helpful. The American Association of the Colleges of Medicine, they have a very large PDF on how to incorporate LGBTQ curriculum into your medical school curriculum. I don't have that right here in front of me, but if you Google, I think if you just Google maybe see. So the American Medical, I'm trying to think out loud what it would be called. If you just go in and Google LGBTQ medical school curriculum, I think it should come up for you, or at least there'll be some websites that come up that give you some resources to go to. I think that would be very helpful. Sometimes maybe the dean or maybe the president of the school doesn't realize that they're doing a disservice, not just to this segment of population that we're going to be treating, but to the medical students themselves. So sometimes letting them know about that. My experience too is that a lot of the comms have like a gay straight alliance on campus, right? A student run club, or maybe they've got something else called like the GSA network, or I think the Medical Student Pride Alliance. I think that's on a lot of the campuses. So the student club can sometimes have a lot of power, to be honest, to kind of come in as a group and say, hey, listen, we feel like we're not getting the care that we need, or that we're not getting the type of curriculum that we should be getting, and we want to talk to you about this. My experience has been at medical schools in general, it doesn't come from the top down, it comes from student-driven change. Right. And so it's okay for you to kind of say, hey, listen, I want us to provide the best care possible to all people, and that includes queer people. So let's see how we can incorporate LGBTQ curriculum into our regular curriculum. Long answer, I apologize, but it's important to know.
Yeah, absolutely, absolutely. Here's a question that we just received. My family knows my son is gay and lives in an open and safe environment, has lived in an open and safe environment since he was 14. He's now 26.
Mhm.
My sister-in-law recently asked me if I could tell if her son was gay. I would like to ask, how can I direct her to allow him time and respect and not to force him to have a conversation until he's ready?
Oh, I love that. So a couple of things. One, if this person feels like their child may be gay or struggling, perhaps mom could go to like pflag.org or at least look up pflag.org and see what resources are available for maybe other parents who are questioning, about their child. So I'm going to go back to that example that I gave you because I hear so many times when people over the country say, you know what, I used what you told me years ago and my child came out to me after I said that. So this is another example again. So I'm dad, all right? Hey, Johnny, happy 13th birthday. I love you very much, and I always will. If there's ever anything in your life, Johnny, that you'd like to tell me, please know that my love for you is unconditional and will never change. And then you drop it. You never then move forward to the next step saying, hey, listen, I'm trying to get you to come out. It's like, what are you talking about? Right? We never want to force somebody to come out because they may not be ready to come out. And that may cause them a whole plethora of mental and physical health and other health issues because of that. But we can set the stage where we're making them realize that we are a safe parent. And when that, trust me, I hear this enough over the decades. When a person then is ready to come out, they will come out to their parent because it's like, hey, dad, do you remember that little conversation we had a couple of years ago when you said that you love me unconditionally? Well, I'm here to tell you something, right? So the bottom line here is to never force somebody out. You can create a safe and welcoming environment like we just talked about, and then you got to wait. You have to wait and allow them to come out when they're ready to. Very good question.
All right. Well, thank you. Well, we have a lot of comments thanking you for this presentation.
That's awesome. That's awesome.
Oh, hold on. I think she was just thanking you for the answer to the previous question.
That's awesome.
Um, so I think if we are sort of at the top of the hour, so people I think may be starting to have to move on. But if there are any final questions, just real quickly in the chat. Let me say again, on behalf of ACOM, thank you, Dr. Holt, very much for doing this presentation.
Absolutely.
We greatly appreciate it.
Yeah, it's an honor. And I realize that it is top of the hour and the hour goes by very quickly, but I'm willing to stay on for a while. If there's others that have to go or go to clinic or whatever, I'm very willing to stay on and answer any questions that people have. If they don't feel comfortable right now asking questions in a public forum or questions come up later, they can always reach out to me. You can go to my website, drronholt.com, drronholt.com, or you can just email me directly at drrholt@gmail.com. That's drrholt@gmail.com. And I'm very willing to help you out. Okay. Because this is the important thing is here is that we are helping each other out, right? We want to do the best that we can. So I want you to see me as a resource for you.
And I will answer the final question that was asked. Yes, this recording will be available once we have it all together. We will send a link out to everybody who attended the webinar. So with that, I'm going to thank everybody who attended. Again, thank you, Dr. Holt, so much. Can't overemphasize how thankful we are that you provided this for us. And I hope everybody.
My pleasure. Yeah, I'm sorry.
No, no, go ahead. I hope everybody has a great afternoon, or rest of the day. And thank you all very much.